Autism spectrum disorders are another class of disorders that also have this similar neurodevelopmental set of causes, probably. So we're going to look at the symptoms, talk about that neurodevelopmental hypothesis again, talk about treatments, and then also different ways that we can think about treatments for autism, because historically they may have been done a certain way, but we're learning more about that from autistic people themselves. So symptoms include things like social differences. Social skills are going to be employed differently. Autistic people tend to find it extremely uncomfortable to make eye contact. They may not understand some of the messages that are conveyed by other people making eye contact. They tend to interpret facial expressions differently or not at all. They spend less time looking at faces than neurotypical people or people who are not autistic. They tend to engage in stereotyped repeated behaviors. This is often called stimming, which is short for self-stimulating. And in small children with autism, you'll often see arm flapping and stuff like that. That's very common. There's like a lot of humming and rocking, but it can be pretty individual. It's really just up to the person. Actually, it seems like all of us do stimming in a way. We all do some kind of behaviors that soothe us, okay? It's just that in autistic people, their stereotyped behaviors, their stimming just looks unusual. Kind of like how, remember in schizophrenia, we've all got beliefs and experiences, but some people's beliefs and experiences are unusual enough that we put a different label on them. And the same goes for stimming. There are also perceptual differences. Autistic people tend to have a harder time with processing senses. Sometimes they can have a sensory overload and go into this kind of emotional meltdown because the world feels really intense, okay? Textures may feel really intense. Temperatures may be difficult to get right. They may be constantly putting on or taking off a jacket and can't get feeling comfortable. Sounds could be overwhelming. Lights and busy visual scenes and bright colors could be overwhelming. And those tend to be stable and lifelong perceptual differences. It's not stuff that these folks can just kind of get used to or habituate to. For some reason, their brain wiring is just different so that some senses are more intense than for neurotypical people. And there's also the opposite. Some senses may be less intense. So they may have hypersensitivity to pain or even a really high pain tolerance. It's a little bit unpredictable and different depending on the person. They also tend to have special interests, which is really kind of like obsessions, stuff that they are just so interested in that it's all they want to talk about, and it's hard to get them to talk about anything else. You might do that briefly and then they kind of come back to their special interest. So they may watch and rewatch the very same TV shows, and they know like tons and tons of trivia about it, and that's all they want to talk about with you. Or they may collect certain items or have other special interests that just put them a little more outside the norm. And also there's often a strong preference for routines. Because autism is a spectrum, right? Most of us can have some of these traits a little bit. As autistic people grow up, they tend to hide some of these symptoms better. So it may look like somebody's growing out of their autism, but it's just kind of a part of your brain development, the way it's wired, that does not tend to change. Okay, so when these symptoms look different in an adult compared to when they were kids, it's mostly because they have learned by that point how to fake quote unquote normal so that people don't think that they're weird and punish them for it. As far as the causes of this disorder, they're actually kind of similar to the schizophrenia ones. You can have vulnerabilities. It's also polygenic and a heterogeneous disorder, meaning there could be many different biological constellations of things that could cause similar symptoms in very different people. Older fathers tend to put people at greater risk of having autism, and this is because whereas female eggs are all created while a person is developing as a fetus and then just released once per month later on in adulthood, male bodies make sperm constantly. In fact, I think it takes about a month to go through the whole life cycle of a sperm cell. New sperm are being created all the time, meaning that as men get older, their older bodies are now making fresh, brand new sperm. And the older a person is, the more likely it is that their body has accumulated some errors in reproducing some of the cells, and that can create some mutations. And so mutations that contribute to a risk for autism are much more likely to come from older fathers. Prenatal illness and toxin exposure is also another one of those clusters of risks. Certain pesticides actually have been linked to autism risk, and certain vitamins, like getting enough folic acid, has been associated with a reduced risk of having an autistic child. Maternal antibodies in some conditions can attack the fetal brain, and this is actually kind of similar to the Rh negative, Rh positive issue in schizophrenia. I encourage you to read more about that part in your textbook with the blood type difference. So this one is not a blood type difference in autism, but it's kind of a similar idea where the mother's body is attacking the fetus in some way through using the immune system. But again, these are vulnerabilities, and it tends to take some kind of other stressors to help those vulnerabilities develop into a disorder. Autism, people tend to think about it like a childhood disorder, but that's just because the symptoms show up kind of early. But just like schizophrenia, the brain could probably be of a schizophrenic person and an autistic person be already on the developmental trajectory for that disorder extremely early in life. It's just that because of which brain areas it affects, some of them are going to show up earlier in life, like in autism, or later in life, like in schizophrenia.